Hi, my name is Kara Rattay. I am a 43-year-old mother. I've been married for 24 years. I have two children. My oldest is 22. My youngest is almost 20. I've been sober for 4.5 years now. I came through Cycles of Change 4.5 years ago because my life was a mess. It was a big mess. I couldn't function as an adult. I couldn't function as a human being. And my children were suffering because of my disease. That's one of the things that I learned at Cycles of Change, is that I wasn't just hurting myself as I always told myself I was. That I'm only hurting me. I'm not hurting anyone else. I learned a lot at Cycles of Change. And then I decided, you know what? I've been a stay-at-home mom for so many years. So I'm going to come back and maybe find a different way of life. Learn to give back some of the things that I was given while I was in treatment at Cycles of Change. So I started volunteering. I came in on, evenings and weekends, and I met with people and just told my story and told what it was like to be an alcoholic and a drug addict. My drug of choice probably were pain pills and opiates, so like the quintessential soccer mom addicted to pain pills. And I was also an alcoholic. I learned to be a great alcoholic, as I am also the child of one. So I hid it well for a while until it became paramount to everything else. After I volunteered for a few months, I was offered a job working in the call center. While I was working in the call center, I went to school online and I got my counseling degree. And then I became a counselor. And I have worked at Cycles of Change for 4 years now. Just doing odds and ends, until I became a primary counselor, which I did. And I have opened the men's program. I worked at the men's program. I helped open the women's program, and I worked there also. And now I work more kind of in the administrative side. Making sure that the program runs the way that we really hope it does. And one of the things that I learned, as an experience of being an alumni, is that when someone comes into treatment, they're terrified. You don't know what to expect. You don't know who's going to be there. You don't know what people are going to say. And it's kind of like walking into a whole different world. But it's a world that gave me my life back. And so when we get new clients in, we really hope to make them comfortable. We introduce them to the people that they're going to be with. We introduce them to the counselors, and then our main hope is to introduce them into a new and better way of life. I completely and totally believe in the 12 steps. I go to meetings. I have a sponsor. I work with a sponsor. I sponsor other women. And the 12 steps have really changed my life. And today, I'm a better person because of that. I'm calm. I'm able to have conversations with people when I get angry without having to lash out. Whenever I have conversations with people that make me upset, I don't have to drink or use a drug. Whenever I have pain, I know different ways to deal with that now. I can exercise and I can eat healthier and keep my body in better shape, and I don't have to take pain pills anymore. And my entire life has changed so much in so many different ways. My children trust me again. My daughter lives with us now, and we have a grandson. And we get to experience that every day. And that would have not have happened if I had not come to Cycles of Change and learned to be who I was meant to be and not who I got trapped into being. One of the things that I also do at Cycles of Change is I facilitate psychodrama, which is an action-based therapy. And basically it's exactly what it sounds like. So if you imagine your life as a stage, and everything is an actor and just props. And so what we do with psychodrama is we act out different issues in life, and we get to learn how to experience those things in a new way. So if I have an argument with my husband, I get to have that argument on a stage, so I can get to see where I need to change and where I need to get better and how I need to improve on my conversation skills and my communication skills. And it's all just corrective experiences and learning how to kind of take yourself out of that little box that we all get stuck in, so that we can learn to just facilitate life better and more enjoyable. So one of the things that sets us apart at Cycles of Change from typical treatment centers that you will find all over the country, and especially in Southern California, is that we are very family focused. One of the things that I believe is that the family suffers from this disease just as much, and sometimes even more, than the person that is affected with it. This is a family disease. So one of the things that we really concentrate on is how to get the whole entire family into recovery. When a person comes into treatment and they learn how to change their behaviors and improve their communication skills, if they go home to a family that is still in a disease of codependency and poor communication, then they go back into the same disease setting in which they left. So a lot of the times this is one of the reasons that we have relapses, is because the whole family unit is not repaired. People learn miscommunication, and they learn anger, and they learn poor coping and behavior skills through practice. Just like addiction is learned through practice. We begin taking a drug, we continue using the drug over time, until we become physically addicted, emotionally addicted, and spiritually addicted. And many of our families respond to us the same way. They are physically, emotionally, and spiritually addicted to those of us that are addicts. So at Cycles of Change, we really focus on helping the whole entire family repair the family system in order to give everyone the best chance of recovery.